Hello there. Thank you very much for joining this program today, focus on African women's health. And if you are joining this program for the first time, it is a program that is dedicated to promoting the health of African women at home and abroad. We share the global message of health for all and emphasizes the importance of not leaving African women behind in optimal health. My name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we explored breast cancer screening practices of West African migrant women in Australia, and we shared findings of a research study and provided link to the published paper from this particular study. And today we promise to look at the meaning of migration for West African migrant women in Australia. Settling in a new country presents a number of health risks to migrants, and migrant women are more vulnerable than migrant men. You may want to ask, who is a migrant? According to International Organization for Migration, a migrant is any person who is moving or has moved across an international border or within a state away from his or her habitual place of residence, regardless of the person's legal status, or whether the movement is voluntary or involuntary, or what the causes of the movement are, and regardless of the length of stay. African women are migrating to other continents of the world as skilled migrants, spouses of skilled migrants, international students, and as refugees. To date, limited studies have actually explored what this means for the women. Our presentation will therefore be looking at the meaning of migration for West African migrant women, and we'll be shedding some light on what it means for this group of women who were either skilled migrants or spouses of skilled migrants. We conducted a qualitative study and looked at the experiences of 21 West African migrant women living in Sydney, Australia. Data for the study was collected through face-to-face, digitally recorded interviews. And a total of 21 West African migrant women, like we said earlier on, took part in the study, 15 of which were from Nigeria, and the remaining 6 were from Ghana. All the women, except one, was married, and majority of them had been in Australia for less than 10 years. Findings from the study revealed that migration for the women meant beginning again. For some of them, they had to begin new career pathways. Some had to begin new jobs at the rung of the ladder. They were lonely, and there was the demand to integrate into an unfamiliar cultural environment. You may be wondering, what then does this mean on the women's health? Beginning again presents the risk of psychological health issues in terms of low self-esteem and a sense of loss. Delay in identification of these health risks can deteriorate to mental health issues. And what we are saying is that the task that lies ahead for healthcare providers who are caring for recent migrants in new countries, such as the participants in the study we are reporting today. The task ahead for healthcare providers caring for them is to advocate in a timely manner and provide adequate support in promoting their health. And that is it for me from now. I encourage you to look at the full details of the paper, the link to which I've provided at the heading of this particular video. You may be wondering what our topic we'll be looking at next week. Next week, and in fact for a couple of weeks from now, we'll be looking at the United Nations Sustainable Development Goals Agenda 2030 and African Union Agenda 2063 together. We will rub minds on practical things that you and I can do in ensuring that African women are not left behind. Meanwhile, my name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Thank you very much for your time today. I really appreciate your being there. And I look forward to our time together next week, Monday, when we will be presenting to you the next edition of this program focused on African women's health. And until then, I say it's bye for now. Thank you.